Good afternoon, everyone. I'm Erica Hartquist, a Media Public Relations Officer for the Oregon Health Authority. Welcome to our Facebook Live discussion. This is our forum specifically for the public to ask questions and get answers directly from our experts. So with us today are Dr. Dean Sidelinger, our State Health Officer, and Dr. Antwon Chavis, Assistant Professor of Pediatrics at Doernbecher Children's Hospital. They will answer your questions today about COVID-19 in children and the recent authorization to extend vaccinations for youth between 5 and 11-year-olds. And we'll begin our discussion today with Dr. Sidelinger.
Thank you, Erica. Thank you all for being here today. Overall, the current state of the pandemic in Oregon is looking far more optimistic than even a month ago. We are seeing a slow but steady decline in daily cases and hospitalizations. We expect that trend to continue based on the most recent modeling. But the Delta variant remains an ongoing threat, and we are still facing limited hospital capacity for all patients. There's still a risk that the flattening of cases and hospitalizations could lead to increased COVID-19 hospitalizations if we relax our vigilance. Also, cases and case rates amongst children in Oregon have been at their highest in recent months, including the number of children diagnosed with multi-inflammatory syndrome in children. Unvaccinated people continue to comprise an overwhelming majority of our COVID-19 hospitalizations. Our breakthrough case data, meaning people who get sick after being fully vaccinated, indicates that unvaccinated people are 4 times more likely to contract the virus. I want to pause for a moment because the numbers and rates we talk about represent our fellow Oregonians, people who were sick with COVID, people who had to be in the hospital to get care, and tragically, many who have died. My thoughts go out to everyone, including families and loved ones impacted by COVID-19 in the last 2 years. More than 2.8 million people, 80% of all adult Oregonians, have received at least 1 COVID dose of the safe and effective vaccines available to protect us from COVID-19. Thank you. And last week, the U.S. Food and Drug Administration and the Centers for Disease Control and Prevention, after a review of data from clinical trials, authorized a COVID-19 vaccine for children between ages 5 and 11. By our estimates, there are approximately 330,000 youth within that age group who are now eligible to receive a COVID-19 vaccine. This is welcome news for younger children and their parents because it gives more people the opportunity to protect themselves and their loved ones from COVID. As we've learned through experience throughout the pandemic, the virus spares no one. Pediatric cases of COVID-19 have accounted for approximately 15% of our total cases. The proportion of cases in this age group increased most dramatically during August and September. You may ask why vaccines are recommended for these younger children between 5 and 11. Our recent pediatric cases are highest amongst that age group. Let me quickly address the safety and efficacy of the vaccines. Similar to what was seen in adult vaccine trials, vaccination was nearly 91% effective in preventing COVID-19 amongst children 5 to 11. There were no severe adverse events amongst vaccine recipients in the clinical trial. Reactions were mild, self-limited, similar to those seen in adolescents and adults and with other vaccines routinely recommended for children, and were less common in those 5 to 11 than in those older children and adults between 16 and 25 years old. Now, I'll turn things over to Dr. Chavis, who will discuss the benefits of COVID-19 vaccinations for children 5 and older.
Thank you, Dr. Sidelinger. So my name is Dr. Antwon Chavis. I'm an assistant professor of pediatrics at OHSU Doernbecher Children's Hospital. And as both a pediatrician and also a parent myself through the foster system, I'm so excited and grateful that kids age 5 through 11 are finally able to receive the COVID-19 vaccine, because we're now able to provide our kids another layer of protection against this devastating virus. As mentioned, our data shows that the vaccine for children is safe and that it's more than 90% effective in preventing severe COVID-19 illness. And although children are at a lower risk of becoming severely ill from COVID-19 compared to adults, it's still possible, especially with the newer variants. As before, the highly contagious Delta variant has caused more children to become sick here in Oregon and across the United States compared with previous variants. And some become so severely ill that they actually require hospitalization. And while information about long-term impacts of COVID-19 in kids is still unclear, we do know that those who contract the virus naturally are at a higher risk for post-infection complications, like the multisystem inflammatory syndrome in kids, or MIS-C. MIS-C is rare, but a super serious condition that's associated with COVID-19 that can cause different parts of the body to become inflamed. So inflammation of the heart or myocarditis, lungs, kidneys, the brain. And according to the CDC, more than 5,500 children nationwide have been diagnosed with MIS-C, and half of those children are between the ages of 5 and 13 years old. At OHSU Doernbecher, we've already treated more than 20 patients for this condition from our own community. And the vast majority of cases either had mild or no symptoms of COVID-19 prior to their MIS-C diagnosis. So the availability of vaccine means that we can really reduce the risk of contracting severe illness and long-term consequences like MIS-C for those aged 5 and up. And I talk about the COVID-19 vaccine a lot. It comes up with nearly every patient encounter that I have. And many families are asking about just possible side effects that are associated with COVID-19 vaccine for children. And while mild side effects like pain at the injection site, headache, fatigue, all those things are possible, they're normal and they're temporary. And honestly, they indicate that the body is building good protection against COVID-19, that the vaccine is working. The clinical trial data for children 5 through 11 says that the risk for severe side effects, so particularly myocarditis or inflammation of the heart, following vaccine is likely to be pretty low. Data shows the highest prevalence of myocarditis between the ages of 16 and 29, males more often affected than females, often after the second dose of the vaccine. And it occurred roughly at a rate of about 43 cases per million vaccine doses given, meaning that if we give 1 million doses of vaccine, we expect to see roughly 43 cases of myocarditis. This inflammation that's associated with the vaccine is temporary, though myocarditis that's caused within MIS-C from actually catching the COVID-19 disease is more likely to have long-lasting consequences. So overall, the benefits of getting vaccinated against COVID-19 far outweigh the risks, and that's for all eligible age groups. So I think it's really important that you talk with your healthcare provider, talk with your pediatrician with any questions or concerns that you might have both before the vaccine and after. And all the additional usual proven public health measures, hand washing, masking, physical distancing, those things are still important, but getting vaccinated is another one of the single best things that we can do to help in the pandemic, keep our families and communities and our schools safe. So thank you for listening. I look forward to sticking around and answering some questions. I'll pass it back to you, Dr. Sidelinger.
You'd think I'd learn how to unmute by now. Thank you, Dr. Chavis. The COVID-19 landscape today is dramatically different from where we were last December when COVID-19 vaccines first became available in Oregon. There is significantly more vaccine available for the 5 to 11 population than there was for the adult population last year. And we don't expect to experience the same degree of scarcity as we experienced then. That said, the immediately available quantities may be limited. As with the introduction of any new eligible group for vaccination, we urge patience. We think it's likely that supply will catch up with demand and keep up with ongoing demand within the coming weeks. But the infrastructure that has been built to support vaccine distribution is extensive and robust, and this is especially true for children. Distribution is based upon provider requests, the type of organization, and the projected capacity for them to get vaccines into arms. The doses that Oregon has coming as an initial supply are anticipated to meet our needs for 4 to 6 weeks. And the state has been assured of access to tens of thousands of additional doses on a routine weekly distribution cadence. More than 350 pharmacies, public health clinics, primary care clinics, community health centers, hospitals, and school-based health centers have been or will soon be receiving their initial supply of vaccine. Families will be able to find appointments or drop-in services in the coming weeks if they are flexible and check with their primary care provider, nearby pharmacies, and other sources. Many providers and local public health authorities are planning to provide special services, including drive-through vaccination, on-site vaccination at schools, community events, and even making pediatric vaccine available at some high-volume vaccination sites that will vaccinate everyone in the family. To find those other options, we recommend checking in with the Get Vaccinated Oregon website for nearby vaccination opportunities and registering to get announcements as events are added. We know it's natural to have questions about vaccinating your child. We encourage parents to talk with their healthcare provider so they can get their questions answered and make an informed decision. As you heard from Dr. Chavis, we can all do our part to protect ourselves, our children, and our families by staying faithful to good habits that have proven to work against the virus. Consistent use of masks in indoors and outdoor crowded settings, good hand and cough hygiene, keeping our distance when we can, vaccination for those who are eligible, and staying home when we're sick. But of those tools, the most effective one for stopping the spread of the virus is vaccination. The available vaccines have proven to be safe and effective at preventing illness, as well as the serious illness and death that we've seen from COVID-19 over the last almost 2 years. Getting every eligible Oregonian vaccinated remains our surest path out of this pandemic. And now, Erica, let's take some questions.
Great, thank you, Dr. Sidelinger and Dr. Chavis. Our first question is from Lori, who says, maybe I missed it, but where can I get the shot for my 8-year-old? Every site I go to says no appointments available.
Thank you for that question, Erica. I think here's where some patience comes in. While we've had many vaccines, and we've, as of yesterday morning, had over 5,000 children in this age group vaccinated, the vaccines are arriving in earnest last week and this week. If your child's provider doesn't have a vaccine appointment available, or the Get Vaccinated Oregon tool doesn't show vaccine availability, sign up for updates or check back in a day or two. Again, the supply is increasing very quickly, much more quickly than the adult vaccine, and you should be able to get an appointment for your child to receive that initial dose and protecting against COVID-19 very soon. Dr. Chavis, did you want to weigh in?
Yeah, I mean, OHSU Doernbecher is providing vaccines on Tuesdays and Thursdays, as well as on all day, Saturday and Sunday. And it's through appointment only. Scheduling availability is online on the OHSU website. Right now, all the appointments through like November 23rd have been claimed, but there'll be additional appointments made as more vaccines become available.
Great, thank you both. Okay, this question just came in from Katrina. Can you discuss transmission rates among those who are vaccinated compared to those who are not vaccinated?
Thank you for that question, Katrina. What we see is that most of the cases we're seeing now are amongst those who are not fully vaccinated. If you're not fully vaccinated, you're more than 4 times as likely to get sick with this virus. We all probably at this point in the pandemic know someone who's had a breakthrough case or who got sick after being vaccinated, but that still represents a real minority of the cases. But what's even more important, those people are in the hospital right now being treated for COVID by an amazing group of respiratory therapists, nurses, physicians, and other staff are almost all unvaccinated. My hearts go out to them and their families, but they are representing the serious diseases we're seeing now, and also the vast majority of the deaths. So vaccine will cut your risk of getting this infection by more than 4, and it will really keep you out of the hospital and keep you from dying from COVID.
Okay, our next question is from Isabel. She says, is it true the risk-benefit model created by the FDA only looked at one known harm from the Pfizer shot, myocarditis?
I think, let me talk a little bit about how the FDA and the CDC review data. Initially, companies who are developing vaccines go through a series of trials, the last one being where they give the vaccine to some people and a placebo, or a shot that doesn't contain the vaccine to others, and see how well it works and look for any adverse events or side effects following the vaccine. This was done for adults, older children, and now younger children. Serious side effects have been extremely rare, but myocarditis or inflammation of the heart was one of those rare effects. Those have been looked for after the vaccine was available and given to hundreds of millions of people across the world, and remains a very rare side effect. As you heard from Dr. Chavis, seen most commonly in males after the second dose, in older adolescents and young adults. The rate of myocarditis from any cause after an infection or following vaccination is much lower in younger kids, was not seen during the clinical trials, but that condition will be monitored for, and we'll see if it shows up at that lower rate in younger children. If it does, it's likely to be mild and self-limited, with children, like older children and adults, recovering. That doesn't always happen after myocarditis or inflammation of the heart following COVID. Many of these people have much lengthier recoveries and many more adverse events. So myocarditis is a very rare event, but it can be seen following vaccination, but it was not seen in the clinical trials and will be monitored for. That sore arm, headache, and tiredness that Dr. Chavis talked about are the most common effects we see following COVID vaccine, like we do following other vaccines.
Thank you. Okay, this is a good question from Rachel that just came in. My child recently had COVID. Should I still get her vaccinated? And if so, how long after the illness?
Great question. We do still recommend getting the COVID vaccine after you get natural infection. We find that the immunity that you get from the vaccine is longer lasting than the natural antibodies that you create from actually being exposed to COVID-19. Afterwards, and Dr. Sidelinger, I might defer that to you a little bit in terms of some of the subtle nuances, but I wouldn't use that as a reason to not vaccinate. Because as we know, you can still get COVID a second time, and the immunization that you get from getting the vaccine is a lot longer than you'll get from natural exposure.
Yeah, thank you. Once your child feels better, has recovered, and is no longer needing to stay home in isolation, it is safe to go out and get the vaccine. A small subset of people who may have been more seriously ill, who got monoclonal antibodies as the treatment, need to wait 90 days. But for everyone else, once you recover, getting that vaccine, as Dr. Chavis says, will provide you longer lasting and higher quality protection from COVID going forward.
Got some great questions coming in. Here's another one from Deborah, who says, my child turns 12 in January. Should I get the vaccine for them now, or should I wait until my child is 12 to get the adult dose?
Thank you for that question. I would say get the vaccine now. This will give your child some head start on getting protection. The dose that was given in children 5 to 11 was very effective, and just as effective as the dose that's given in older children and adults in protecting against this disease. So get your child an appointment scheduled now to get their first dose, with their second dose at least 3 weeks after. For parents of children who may be turning 12 even sooner, it's okay to get your first dose of vaccine before their 12th birthday. They'll get the smaller dose that was tested in younger children. And if they have their birthday before their second dose, they'll get that larger dose. That will give them protection. Those 2 doses spaced 3 weeks apart are the best protection for your children and our best way forward in protecting ourselves from COVID-19.
Thank you. Joe is asking, what are the long-term effects of COVID versus the vaccine?
Great question. I mean, hopefully, ideally, if you get COVID, the long-term effects hopefully are that you recover and then get vaccinated afterwards. But there are the higher risks for some of both the post-infectious changes. So especially in children, let me see that we chatted about, or other changes to just vital organs, and then the risk for like the long haul COVID. So having long-term symptoms that just take a long time to kind of resolve. In terms of the long-term kind of side effects or risks for the vaccine, the mRNA-based vaccines are processed within a few weeks after getting vaccinated. And the processing includes just breaking down and removal of all of the vaccine components. And so the only thing that really remains after that period is your immunity that is generated that's going to protect you against further exposure to COVID-19. So we don't expect that there will be any long-term effects, and all the monitoring that we do for complications tend to be in that shorter period for the first few weeks after getting vaccinated.
And let me just add that this vaccine is very similar to other vaccines, where those side effects will show up within the weeks after the vaccine. And while we're only now vaccinating younger children routinely in the community, we've been using this mRNA vaccine from Pfizer for about a year now. And there are no long-term side effects that are seen from this vaccine in older children or in adults. This is a very safe vaccine, and it works really well at protecting us from COVID-19.
Thank you. Mary is asking when children will be mandated to get the vaccine.
I'll take this question, Mary. A lot of parents have been asking that question. I think some parents are concerned about sending their kids back to school and want to have the most protection, whereas other parents want to make sure that they can get their question answered and make a decision for themselves and their child and their family. Oregon has a process in place to add vaccines to the currently listed schedule of vaccines that are required for school entry. This vaccine would rely on a vaccine being fully approved for use in children of school age. It would involve convening an advisory group to talk about the risks, benefits, and other aspects of adding that vaccine to the group. And it would involve community outreach and public meetings to decide about this vaccine. This process would not even be able to be started right now, and would take several months to more than a year. So I don't see the COVID-19 vaccine being added to school vaccinations anytime soon. Parents still need to get the currently required vaccines, and I would really encourage parents of those 5 to 11 to get your child vaccinated now. But if you still have questions, and that's natural, talk to your healthcare provider, look for some reputable sources. We can drop some links in the chat to look at how this vaccine was developed, how it works, the side effects, and how it protects people, so you can make that informed decision for your child.
Thank you, Dr. Sidelinger. This question here from a parent: what are some side effects of the vaccine? For instance, can we send our kids to school right after vaccination, or should they take off school?
Great question. I don't know that I would anticipate significant enough side effects that you should change the day-to-day habits that you have. So if a kiddo has, a fever, or if they feel very fatigued to the point that participating in their sport or activity might not be super safe, then I think that they can avoid it in that instance. But if it's just a sore arm, if it's just a little bit of fatigue, I'm trying to normalize and try to have the clear expectation that it's going to be short term, that it means that your vaccine is working and that you're developing an immunity to COVID-19. I think as long as that's very clear, I think you can kind of continue on with your regular day to day. I wouldn't make any changes unless you as a parent have a specific concern, but they should be safe to continue on with the regular activities.
Thank you. Jessica's wondering, do you wait 3 weeks from the first vaccine or 4 weeks? I think she writes here that she read somewhere that it should be 4 weeks apart, and then is also wondering if there's a fact sheet that will be given to those who have received the vaccine.
Thank you for that question, Jessica. I think there definitely is a fact sheet that's given that has information about the vaccine, about side effects you may expect, and other things. So you will get that for your child, for you to read when you get the vaccine. It's currently recommended that we wait 21 days between the first dose of Pfizer-BioNTech vaccine and the second dose. This is similar to the spacing in older children and adults. If you can't get a second appointment within those 21 days and you have to wait 4 weeks or even 5 weeks, it's okay to go ahead and get that second dose. But starting at the 21 days following the first dose is when you can schedule an appointment for your son or daughter to get that second dose.
Thank you. And I hope I'm pronouncing this name correctly, but Arinka writes, children with special needs sometimes, well, most of the time, require a lot of accommodations when they get vaccines. And right now, all of that is impossible. When do vaccines become available in regular pediatric offices? Are there any plans to support them at this time?
Great question. I think that's going to vary between offices, where some are going to have the resources to be able to carry it in office, some are not. I know of like hospital systems and a few of the private practices in the community are already able to do vaccines that way, but it totally depends on your provider. Hopefully there's going to be some sort of announcement or clarification is going to be provided to families, likely on a mass communication basis. But if you have specific questions, you can always call, being understanding that a lot of people are all probably calling at the same time, and it might take a little bit of time to get that answer. But if you've got an appointment you're already scheduled for, a well-child check or an acute visit or a follow-up, it's always great to ask your provider because they likely have at least some idea of the process that will roll out to allow them to get the vaccine in the clinic. But you're right, I think there are things that you should do in terms of preparing your child ahead of time, especially if they are either anxious with vaccines, if they've got a history of allergies, and letting the kiddo have an understanding of what they're doing, why they're getting the vaccine, how they can expect to feel afterwards, the things that they should expect not to feel afterwards. And then when you get there to provide the vaccine, making sure that if there are any allergies or anything specific that needs to be known about your child, that they know that so they can make sure that they're monitoring and providing whatever resources that you need.
Great. Thank you, Dr. Chavis. We have a clarifying question from Jessica. She was the one who had asked if you wait 3 weeks from the first vaccine or 4 weeks. Her clarification was, sorry, before getting the second dose. So her question was specifically for the second dose.
Correct, and thank you, Jessica. Taking the time to ask a follow-up question, I think you're really concerned about and want to get your questions answered for your child and their vaccine. It is 3 weeks, 21 days between doses for the Pfizer-BioNTech vaccine for all kids and adults. There is a 4-week spacing between the Moderna vaccines, and that may be where some of the confusion comes in. But for the Pfizer vaccines, after 21 days following that first dose, you can schedule the second dose, and then your child will be fully protected kind of 2 weeks after that second dose. So there is, a period of time where they have some partial protection, but 1 dose, 21 days later, second dose, 2 weeks later, protection.
Thank you, Dr. Sidelinger, for clarifying. Darcy is asking, will the vaccine make you sterile?
Let me start with that and then turn over to Dr. Chavis, because this is a question I think both of us get a lot. There is no evidence that the vaccine will make you sterile. In the clinical trials, while they didn't go out to enroll pregnant women, we know that many women got pregnant while participating in the clinical trial at similar numbers in those who got the vaccine and those who got placebo. In the hundreds of millions of vaccines that have been given, we've seen no evidence of impact on fertility with women getting pregnant after being vaccinated, with men after they've been vaccinated able to father children. We know that pregnant women may get more sick with COVID-19, and so the vaccine should be given to pregnant women to prevent them from getting more sick, and we encourage everyone who's pregnant who's not yet vaccinated to talk to their healthcare provider about getting the vaccine. When we look at the scientific basis for this, it's not possible. This vaccine is made of mRNA. This is the recipe for the body to make a protein so your body can create a protective effect, can respond to that and protect you the next time that you get sick. That mRNA, that protein, are destroyed by the body within weeks. They never enter the nucleus or the center of the cell where our genes and DNA are. They can't get into the nucleus. They can't get into the DNA, and they're destroyed within weeks. So there's no evidence of impact on fertility. And that's held true in the hundreds of millions of doses that have been given there. Dr. Chavis, do you want to talk about some of the questions you get in clinic?
Yeah, I think there's been a couple of newer kind of smaller studies that have been really promising. One following women in vitro fertilization clinics where it was checked to see beforehand, before treatment, if they had antibodies from the vaccine, antibodies from being naturally ill, or no antibodies from either illness or the vaccine. And they found that there was no difference in pregnancy success rates amongst these 3 groups of women. And then in terms of men, a smaller group of about 45 healthy men that received the vaccine mRNA, so either Pfizer or Moderna, looking just at sperm characteristics and they found that there was no changes to the quality of the characteristics, though sometimes after vaccination, you can develop mild fever for about 24 hours, and hypothetically having fever can decrease sperm production, but that has not been shown to actually create a decrease in reproductive rates. And again, the rates go back to normal once the fever is gone. And I know it would be silly to answer this question without acknowledging that historically there have been some unfair treatments of certain marginalized groups, Native Americans, African Americans, involved with research studies that might have been tailored towards changing reproductive rates, or maybe being a little bit dishonest with some of the purposes of those studies. And so I think that as a kind of modern medicine, as it kind of progresses, we've learned a lot from the way that those studies were done, the way people were treated. And there was a lot of minority involvement in the production and creation of these vaccines, and specifically to people of color that asked that question. I have no concerns regarding this vaccine and fertility rates. That's not an issue. It's not possible to create an issue based on this type of vaccine.
Thank you both very much. Okay, Lisa Faye says, this may be too early to ask, but are there plans for pediatric doses for children younger than school age?
Thank you, Lisa. I think there are studies ongoing now for children younger, down as low as 6 months, and some that go down to 2 years. We would anticipate those studies to complete their enrollment, to look at the data over the next few months, and possibly in the new year, we could see vaccines that are safe and effective for this population as well. So let's celebrate the fact that our 5 to 11-year-olds are eligible for this vaccine now, and look forward to the day when even younger kids and virtually all of us are eligible for this safe and effective vaccine. And I know that was probably our last question. So let me just pause and say thank you to Dr. Chavis for joining us on this topic. Thank you to OHSU and Doernbecher for their partnership in the vaccine rollout. But especially thank you to all of you for tuning in and asking your questions. I'm trying to seek out information about these vaccines for your children. We know that they've been anticipated by all of us throughout this pandemic, a chance at protection for more individuals, and getting your information, your questions answered is most important. If you go to the website, healthoregon.org/coronavirus, you can sign up for our newsletter, find a link to the Get Vaccinated Oregon site and other information about COVID. But thank you very much for your time today.